Was little, I was very sick and I was in the hospital all the time. And as a small child, it felt like magic when I went into the hospital very sick and then came out well. So I was interested in it from a very young age. And then for Gyn-Onc, initially when I did what is called a summer internship in medical school, I was doing it really only for a letter of recommendation. I didn't think I would like it. I thought it would be very sad, but I really fell in love with a specialty when I was doing that rotation in medical school. I found that we're doing a ton of procedures and really we're exposed to the whole gamut of medicine. So from complex internal medicine concepts to complex surgeries. I thought it was very interesting. Really the only thing we don't do in Gyn-Onc is take care of men, which I'm fine with. But then what I realized was everybody goes into that initial appointment with their oncologist thinking things are going to be very sad, and you can really make things much better for patients. So you can really make a huge difference in someone's life in this field. I had a few years of experience working in a different location, and I was very interested in working in this kind of holistic, small but multi-specialty private practice environment where we can work closely with both medical oncologists, radiation oncologists, and I feel it's a very cohesive place to get care, and patients seemed really happy here. And then Fresno, overall underserved area, and it was a geographic location where a lot of patients need care, and so I felt like I could make a difference here. Yeah, so one of the most important things I think you can do with a new patient is make them feel comfortable and make sure they understand what's going on. So communication is very, very important, and communicating at a level that patients understand, because sometimes they don't understand the language or the anatomy that we're talking about. So starting from the ground up, really, in terms of explaining why we're there and what we can do to help them. And I want them to always leave the appointment feeling like they have a plan, they know what's going to happen next, and that they feel a little more in control. First visit, it will usually be both a counseling and exam visit. So we'll try to be very thorough, cover a lot of ground in that first visit. So my goal is that if we don't have a diagnosis at time of our first visit, we either have one at the time of our next visit or at least have a plan to obtain one. I feel like what I said earlier about being able to make a big difference in people's lives, I think truly I get to experience that. It's, as primarily a surgeon now, I'm very simple. Like I'm like a mechanic. So I could go in and fix a problem with my hands and really see how someone can improve after that. We can take away their pain and, get them a better outcome, get them a better life expectancy. And that's very rewarding. So it really appeals to that simple part of me that wants to go in and fix something and then have watch their outcome, which is hopefully going to be very good.